Hi, my name is Atiqa and I am from Group 23. Today, my topic will be about professional boundaries. So, what are boundaries? Boundaries, in the context of doctor-patient relationship, boundaries are unspoken limits on your physical and emotional relationship with patients. Our ethical behavior with patients and families. They expect us to act in their best interests and treat them with dignity. And we should do that by not taking advantage of a patient's situation and by avoiding inappropriate involvement in the patient's personal and family relationships. We should also strive to keep our relationships professional and actively work to find a balance in our relationships with patients and families. Here are the violations of professional boundaries, basically the actions that violates these boundaries. Firstly is by discussing your personal problems with the patient or his or her family members, especially when it doesn't have to do anything with the patient. Next is being flirtatious with a patient, including using sexual innuendos, telling jokes that are sexual in nature, or using offensive language. Also, the activity that's about discussing your feelings of sexual attraction with a patient, it might come off as sexual assault. And feeling that you may become involved in a sexual relationship with the patient is really inappropriate. And next is keeping secrets with a patient and becoming defensive. Thinking that you are immune from having an unhealthy relationship with a patient is also dangerous, and also believing that you are the only nursing assistant who can treat the patient. Spending an inappropriate amount of time with the patient, including off duty visits or trading assignments with others to be with the patient, this is really unprofessional. Reporting only partial information about the patient, it's really bad to do so because it hinders the patient's treatment. And also feeling that you must protect the patient from other workers and always siding with the patient's position. This is involved with the behavior of enabling. So the consequences of boundary violations, this will lead to inappropriate relationships, and it can make you cloud your clinical judgment and often carry over into personal life. It may cause us to do things that we would not ordinarily do, for example, breaking laws and doing something aggressive. So for your own well-being, for our own well-being, we have to be aware that professional boundaries exist and actively take steps to keep from crossing them so that we don't suffer from the consequences. This is an action that's related to the violation of professional boundaries. It's called enabling. Enabling is an act of shielding a patient from the consequences of his or her own behavior. This will allow the patient to be irresponsible. It's not the same as helping, and it causes dependency rather than moving the patient towards independence and good mental health. It will not help the patient at all if you do this kind of action. And now here is an example of violation of professional boundaries. Hi Sylvia, I am Dr. Atiqa. How may I help you today?
Hi, doctor. I need help because I'm suffering from a broken heart. My husband cheated on me.
Really? That's awful. My husband cheated on me too. I found him with some other woman in a diner last Friday. It was terrible.